Hello, I'm Dr. Erin Bell. I'm a family physician in the Cleveland area. I'm so happy to be able to talk with you today. And today's presentation is on Know Your Numbers. This video presentation is brought to you by Take Charge of Your Health, a collaboration with Northeast Ohio Medical University, the Partnership for Urban Health, the Cleveland Public Library, and the Cleveland Foundation. Take Charge of Your Health are videos, and they're for educational purposes only and are not to be used for treatment or diagnosis of any medical condition. Please see your primary care physician or provider for treatment and diagnosis of any medical condition. The objectives of your Know Your Number video is to know the importance of cardiovascular risk, what numbers you should know, and how to improve your numbers. Why are numbers important? We know tons of numbers. We know Social Security numbers, telephone numbers, birthdays, and account numbers. But how many of us know our health risk numbers by heart? These numbers allow you to know your cardiovascular or heart disease risk. They assist you in making lifestyle changes, and they promote a collaboration with your healthcare provider. Ways to have a good conversation of how you can improve your overall health. And it allows you to make being healthy a family discussion. Numbers you should know: blood pressure, hemoglobin A1C, cholesterol, and lastly, body mass index. We will go over each one in detail. Blood pressure. Blood pressure, as we've all heard, is a silent killer because usually we don't know that our blood pressure is high if we're not getting it checked on a regular basis until we have a catastrophic event, such as a heart attack or a stroke. Blood pressure is the amount of force pushing against our blood vessel walls, which are known as arteries. And why is blood pressure so important? Because if it's too high, it will put stress on our heart and our arteries. So we aim to have everyone's blood pressure at 120/80 or less. But those who have diabetes and high blood pressure, it may be more difficult to get to that optimum number. That's why having a relationship with a primary care provider is great, because then your blood pressure optimal range can be discussed with them in person. Next is hemoglobin A1C. This measures your average blood sugar over the last 3 months. We use it to diagnose and to monitor for diabetes. I call this the true test of whether or not a patient is doing what they're actually supposed to do. A lot of times my patients will come in and they will fast the day of the visit, or a week or so beforehand, they will limit the amount of sugar that they have in their diet. So then when we actually do the finger stick blood test in the office, they get a great reading. But the hemoglobin A1C lets me know what's truly going on over the last 3 months. We look to see if patients are in the normal range, which is less than 5.7, if they're in the pre-diabetes range, which means they're at higher risk for developing diabetes and the complications that go along with diabetes, or whether or not they have diabetes. We then, after that, if they have diabetes or pre-diabetes, we will frequently monitor this level to make sure that the treatment that we have in place is working. Cholesterol. We've all heard of cholesterol, and it has received a bad rap over the last couple of years. But cholesterol is important for the body. It helps with hormone production, vitamin D production. It forms the digestive bile that we use to digest our food. And most importantly, it helps with our cell membrane structure. But you can have too much of a good thing. And so we want everyone to fall up under the desirable range, which is in green. Total cholesterol is made up of LDL, HDL, and triglycerides. LDL is the bad cholesterol. An easy way to remember that is it begins with L. We want that number low because it's lousy. HDL begins with H because it's the good cholesterol. It makes our body happy and we want that number high. And then triglycerides are the last component that makes up total cholesterol. We want to try to move everyone out of the borderline high and high range to the desirable range. And that's making healthy lifestyle choices, which we'll talk about later on. The last number is the body mass index, which is a calculation based on height and weight. It's one way to see if you're at a healthy weight. The healthy weight range is between 8.5 and 24.9 for your body mass index. As your body mass index increases, you increase your chances of chronic medical conditions. So we always talk about numbers, 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 and I explained to you why you need to know your numbers. But the hardest part is, how do I put things in action? I know my numbers, and what should I do? So I'm offering you 4 easy steps. 1, know your numbers. Schedule a visit with your primary health care provider, or attend a health fair, and a lot of times the health fairs will screen for these 4 numbers. Keep a record of your numbers and compare your numbers from year to year. This will allow you to evaluate what changes you need to make. Learn more and ask more questions. When you get your numbers, ask what they mean. What should you do to improve them? And then learn more on your own. A great website is the American Heart Association. They actually have detailed information about each one of these numbers. Step 2 is to adopt a healthy lifestyle. Aim to get 10,000 steps a day or 150 minutes of exercise per week. Always talk with your healthcare provider before starting an exercise regimen. If you smoke, stop smoking and seek the advice and care of a specialist, your healthcare primary care provider, or a smoking cessation specialist to help you stop smoking. And limit the use of alcohol. Eat the rainbow. Make sure you incorporate fruits and vegetables of a wide variety of colors, and don't forget to eat those healthy fats. Step 3 is create your support team. Your primary care provider can serve as part of your support team, but make healthy living a family affair. And share your numbers with your support team. They will help to be your accountability partners. And lastly, monitor your progress. Evaluate your progress. Figure out what you've done that's worked and things that you need to improve on. Reevaluate and go for it again. So don't forget those 4 numbers: blood pressure, A1C, cholesterol, and body mass index. Take care and have a great day.